Does your child have no jawline? Are you super concerned that their jawline is just not as strong as you'd like it to be? Watch this video. We're going to dive into the reasons why that may be developing, what you can do about it, and what role genetics plays in this process. I'm Dr. Ryan Vaughn, board certified ENT. You have found XL Sinus's YouTube channel where we aim to make seemingly complicated medical problems easy to understand. So first, let's talk about what's happening when your child's jaw is developing. Clearly, the size of a face of a baby is smaller than the size of an adult, but what is it that actually pushes that growth and development forward? Is it all genetics? No, it's not all genetics. Of course, there are genetics that play a role. Even syndromic processes that create changes to our face are actually something that's happening within the mouth, and that is changing how the face is developing. But what is happening in the mouth? What we know is that in kids who are eating higher fiber and harder to chew and crunch foods, they are starting to develop a better bony structure of the face, including the mandible and the mid-face maxilla. This is happening because bones grow from muscles pulling on them. When the muscles of chewing or muscles of mastication are working hard to chew food, it's going to pull that bone into a more favorable position because the bone needs to be there to support and stabilize the strong muscle use. It's why we actually know that strength training is one of the best preventions for osteoporosis as we age. But back to your kid's face. Genetics can play a small role, but the more important role is what they're chewing today and how they're breathing through their nose. If your child has a hard time chewing with their mouth closed, if your child is sleeping with their mouth open, these are two signs that your child has significant nasal airway blockage, and that should be addressed right away. ENT physicians are equipped to evaluate for all of the causes of nasal obstruction and recommend therapies that can be done in order to reverse whatever's going on. And before you get too scared, that is not always surgery. There are many natural remedies that are extremely useful when you know what the underlying problem is. So that's where your local friendly ENT doctor can be very helpful. Things that you can try at home even before seeing the ENT include saline or xylitol containing nasal sprays. These mists can help to thin out the mucus and in some cases even make the tissue in the nose less swollen. Creating habits where your child practices placing their tongue on the roof of their mouth while maintaining nasal breathing can help to train their body that this is what we're actually trying to achieve. Working with a myofunctional therapist can give you even more exercises and help to troubleshoot difficult to manage situations. Lastly, if you find that your child is actually a super picky eater, it's less likely that that's a personality trait, but more an airway and jaw trait. Your child may actually be having a hard time managing the food in their mouth because of how their teeth meet up, how their jaw moves, and how difficult it is to breathe through their nose while they eat. Once we've identified these underlying issues, we are now placing kids onto a new base where they can start to develop that strong jawline, that perfect mid-face, and the facial symmetry that we're really looking for. If you like this style of content, give me a like and please share this with someone who needs to know this information. I'm Ryan Vaughn, and thank you for following us on the XL Sinus YouTube channel.